The dilemma of cracked teeth. A crack in a tooth can cause several specific problems, each of which can vary in severity depending on the location and the extent of the crack. Here are the key issues that a crack can cause. Biting pain. Cracks often cause sharp pain when biting down, especially when releasing the bite. This occurs because the crack allows the tooth segments to move slightly, irritating the nerves in the pulp. Temperature sensitivity. The crack can expose the dentin layer, which contains tiny tubules leading to the tooth's nerve center. This exposure can result in heightened sensitivity to hot, cold foods and drinks. Infection risk. A crack can allow bacteria to penetrate deeper into the tooth, reaching the pulp chamber where the nerves and blood vessels reside. This can lead to pulpitis, which is inflammation of the pulp, or a dental abscess if the infection spreads. Gum infection. If the crack extends below the gum line, it can also create a pathway for bacteria to enter the surrounding periodontal tissues, potentially leading to gum infections or periodontal abscesses. Structural weakness, leading to tooth fracture. A crack compromises the structural integrity of the tooth, making it more vulnerable to breaking and splitting. This can result in a significant portion of the tooth breaking off, especially under the stress of chewing. Compromised restorations. If the cracked tooth has a filling or crown or other restoration, the crack can undermine the stability of these restorations, leading to their failure. Difficulty in treatment, leading to complicated restorations. Cracks can make it difficult to achieve a reliable bond when placing fillings or crowns, as the crack might extend through the tooth, preventing the restoration from sealing properly. Root canal complications. If the crack extends to the pulp down to the root, a root canal may be necessary. I prefer a root canal not be done, but after the whole health approach is followed and all factors uncovered, it may be deemed appropriate. However, cracks that extend to the root or beyond can complicate the procedure and may lead to failure or persistent infection. Long-term risks include tooth loss. In severe cases, especially when cracks extend vertically through the tooth and into the root, extraction may be the only viable option. Even with treatment, a crack can lead to chronic discomfort or recurring problems such as persistent pain or repeated infections, especially if not properly managed. The home care regimen for optimal tooth and gum health is a protocol that may help these cracks. It can be found in number 6 daily protocol in the info sheet table of contents. Cracked teeth present a significant challenge in dentistry due to the uncertainty in diagnosis, treatment, and long-term prognosis. Here's a more detailed look at the complexities associated with cracked teeth. Diagnostic challenges, especially with subtle symptoms. Cracked teeth, when present with subtle intermittent symptoms, such as pain when biting, sensitivity to temperature changes, these symptoms can easily be mistaken for other dental issues like cavities or gum disease, making the diagnosis difficult. Invisible cracks in teeth can be microscopic and may not be visible on standard x-rays or photos. Sometimes the crack only reveals itself during specific conditions, such as when the tooth is subjected to pressure during biting or chewing. This makes it challenging to pinpoint the exact location and extent of the crack. This scientific article, a narrative review of cracks in teeth, etiology, microstructure, and diagnostic challenges, shows how teeth have a natural ability to heal and prevent progression of cracks. Enamel is the hardest substance in the human body, but at the surface, the enamel rods are parallel and can separate. This illustration from the article shows the design of enamel and dentin and how it can help resist the progression of fractures. Enamel rods are decussed or crisscrossed at deeper layers, which increases their strength. Beneath the enamel layer is dentin, which is more resilient. When a crack from the enamel approaches the dentin, it creates ligament bridging, further reinforcing the tooth. The odontoblasts in the pulp chamber help create secondary dentin. Vitamin K2 nourishes these odontoblasts, so K2 supplements, such as Total K2, is very important for nourishing and strengthening teeth. Other factors can exceed the natural defense of the tooth, and that's when cracks become problematic. Here is a table of these factors from the article, which include intact teeth and teeth with restorations. Bite issues, which misdirect forces, can be a factor, especially when one clenches or grinds their teeth. Clenching and grinding creates forces 4 to 5 times the normal chewing force, so a lot of damage can be done. Clenching and grinding is a habit. A habit can be stopped or changed by getting the right message to the subconscious mind. See number 8, clenching and grinding, in the info sheet table of contents for a self-hypnosis audio to help stop the habit. A biofeedback device like the Muse S can help make you meditate better, sleep better, and more deeply, so it can help decrease clenching and grinding. Chewing on ice or other hard foods or objects and cycling hot and cold foods and drinks can make enamel prone to cracking. Restored teeth also can be more prone to fracturing, so the design of the restoration needs to be correct as well as the design of the bite. The more conservative the design, the better, because you are conserving healthy, natural tooth structure. That is why I prefer direct bonded composite onlay restorations whenever possible. Cracked teeth also present with treatment uncertainty because of the potential extent of the crack. The treatment plan largely depends on the location, depth, and direction of the crack. If the crack extends into the root, it can compromise the tooth's structural integrity, leading to a more complex treatment process. In some cases, it might be difficult to determine the extent of the crack until treatment is underway, leaving the dentist and the patient with uncertainty about the best course of action. This picture shows how cracks can be hidden from sight and how their location and extent can lead to the tooth's demise. All this needs to be taken into consideration. Treatment options vary widely, from bonding and crowns to more invasive procedures like root canals, which I try to avoid, or even extraction. Deciding on the right treatment can be challenging without a clear understanding of the crack's behavior and progression. An uncertain prognosis and questionable longevity can have unpredictable outcomes. Even with proper treatment, the long-term prognosis of a cracked tooth can be unpredictable. Some cracks may stabilize and not cause further issues, while others may worsen over time, leading to the need for more extensive treatment or even tooth loss. The patient's response. The success of treatment can also depend on how the patient responds. Factors mentioned earlier, like bite forces, clenching and grinding habits, and overall oral hygiene and diet, can all influence whether a cracked tooth remains stable or deteriorates. Monitoring and follow-up is very important. Because of the uncertainty associated with cracked teeth, ongoing monitoring is essential. Regular checkups and patient vigilance in reporting new symptoms are crucial in managing the condition effectively. Potential for recurrence. Even after treatment, there is a possibility that the crack may recur or new cracks may develop, particularly in teeth that have been subjected to significant stress or have undergone multiple restorative procedures. Patient education and informed decision-making is essential. The whole health holistic approach has informed choices as its foundation. Given the uncertainties, it is vital that the patients are fully informed about the risks, benefits, and potential outcomes of each treatment option. This empowers them to make decisions that align with their health priorities and risk tolerance. Cost considerations are also important. Patients should also be made aware of the potential for ongoing treatment costs if the initial approach does not provide a permanent solution. Understanding the financial implications is a key part of the decision-making process. In summary, the uncertainty of cracked teeth requires a comprehensive, cautious approach to diagnosis, treatment, and long-term care. By thoroughly evaluating each case and maintaining open communication with the patient, dentists can help manage unpredictability and improve outcomes for those with complex dental issues. HolisticDentalLearning.com is an ever-evolving site whose goal is to be your go-to educational resource for holistic whole health dentistry and optimal self-care. The products talked about in this video are available on HolisticDentalLearning.com and also through the links listed below. If you have questions or would like a particular subject related to holistic dentistry discussed, please comment below, or you can contact me through the Contact Us button on the site.